Fit, strong, healthy. That's what we all want, whether young or old. But good health can't be taken for granted. So it's good to know there are people working hard for our health, and there to help us when we're sick. In fact, healthcare is one of the largest sectors in the economy, and it's continuing to grow. There are a number of reasons for this. Many illnesses that were once fatal can now be successfully treated. And thanks to modern medicine, people live much longer than they used to. Yet that success creates new challenges. The older we get, the longer we need good health care. There is also growing demand for preventive care and wellness. And many people today are focused on living a healthy lifestyle. This is not only true in the industrialized countries. Many emerging market nations are also steadily expanding healthcare. This increases demand for affordable care in these countries too. By continuously seeking and finding new answers to these challenges, healthcare companies are driving medical progress. Fit, strong, healthy. That's what we all want, whether young or old. But good health can't be taken for granted. So it's good to know there are people working hard for our health, and there to help us when we're sick. In fact, healthcare is one of the largest sectors in the economy, and it's continuing to grow. There are a number of reasons for this. Many illnesses that were once fatal can now be successfully treated. And thanks to modern medicine, people live much longer than they used to. Yet that success creates new challenges. The older we get, the longer we need good health care. There is also growing demand for preventive care and wellness. And many people today are focused on living a healthy lifestyle. This is not only true in the industrialized countries. Many emerging market nations are also steadily expanding healthcare. This increases demand for affordable care in these countries too. By continuously seeking and finding new answers to these challenges, healthcare companies are driving medical progress.
A special good morning to the Honorable Senator Mutahi Kagwe, Cabinet Secretary, Ministry of Health of Kenya. I would like to also say a special good morning also to Dr. Francis Smart, Director of Policy Planning and Information of the Ministry of Health and Sanitation of the Republic of Sierra Leone. Good morning, ladies and gentlemen, distinguished speakers, participants from around the world. My name is Edem Kofi Ebuche. I'm General Manager at the World Trade Center Accra, and it gives me great pleasure to welcome you to this maiden edition of the Africa Health Industry Summit. I would like to, at this point, especially mention two of our key commercial partners, Phyto-Riker and GCNET, for the support that we received from you to make this summit possible. With the help of our partners and the team at the World Trade Center Accra, much gratitude to Esther, to Linda, and to Faith, and all the team that supported behind the scenes. We have been able to assemble today a truly diverse audience from over 20 countries in and out of Africa to hopefully examine the pulse of the health sector in Africa and possibly engender some crucial partnerships for the advancement of healthcare delivery on the continent. Issues concerning healthcare are very important because for us to continue to progress economically as a continent, we need a strong and healthy population that is working to drive the agenda of our governments. And so health is very, very critical. There are new technologies that are transforming healthcare delivery across the world, and some of these technologies are available on the continent or making their way into the continent, and it's important that we make it easier for healthcare service providers to adopt these technologies in order to advance healthcare delivery. Also, Africa is faced with new challenges, the diseases that were not so prominent before. Lifestyle diseases like hypertension are on the rise as the middle class grow, and access to healthcare remains a key challenge on the continent of Africa because we have some of the lowest access rates when it comes to all the indicators of healthcare delivery on the continent of Africa. For instance, there are not enough hospitals, there's a shortage of healthcare professionals. We all know this, but recent developments such as the COVID-19 pandemic have thrown a sharp focus on some of these problems and have made them more apparent on the continent. Yet still, the healthcare industry remains one of the most sort of important, one of the most prominent, fastest growing, with the best prospects on the continent of Africa. And it's important that we direct investment and support into this sector in order to make sure that we are not only able to take advantage of it as commercial entities, but also to deliver critical healthcare to the people on the continent. Without going too much into talking about who we are and what we do, I'm sure there'll be enough opportunity for us to do that later. I'd like to go straight to invite Madam Mrs. Teresa Yamson, CEO of Phyto-Riker, to give us a presentation on building a healthy nation, the role of the pharmaceutical industry in promoting health. Mrs. Yamson, the floor is yours. I'll hand over to you now, and I'll come back to you, the audience, later. Thank you very much.
Thank you, Adam. And good morning and good afternoon to everyone. I'm especially glad to be part of the panel members for the Africa Health Industry Summit. To our entire audience as well, I say a very big hello. So perhaps we can get started almost immediately. So today I would like to be sharing with you a little bit about how the pharmaceutical industry is helping to promote better health within Ghana. My talk today, I'll focus a little bit about the pharmaceutical landscape within Africa, especially about the industry in Ghana, and touch upon the health concerns that are plaguing the Ghanaian population and how the pharmaceutical industry is working to support them. I'll mention, of course, some of the challenges faced by the industry. We're talking about health here, so this is quite important for us. And the innovative solutions that we're working towards to ensure that we can actually overcome some of these challenges. And then finally, what the future holds for us. So our African continent, 54 countries, has approximately about 600 pharmaceutical companies scattered across. You'll see that predominantly you have most of them in the north. So we have about 8 countries who are driving the pharmaceutical industry. And this is in Morocco, Algeria, Tunisia, Egypt. Then when we come to the west, say Nigeria, east, you're looking at Kenya, and of course, South Africa. Now, this then means that you perhaps have about 22 countries where you do not have a pharmaceutical industry base. Now, how has it been that perhaps this dispersion in the north, I would say west, east, and south has come about? A little bit because of the economic development that is happening within these countries, obviously is driving the sector. Then some protectionism in the market as well for the different countries and how that has helped to develop the pharmaceutical industry. But of course, strong local demand is a driver in order to ensure that the pharmaceutical industry can continue to grow and develop. But what is also interesting to notice, you might think, yes, Nigeria has about 120 versus say Ghana having 30 to a little closer to 40 pharmaceutical companies. But if we were to compare population size with respect to the number of pharmaceutical companies, you then have to rate Algeria as the number 1, with about say 2 companies per million people. Followed by, of course, South Africa, 1.69, almost 1.7. And then Ghana is surprisingly third with about just over 1.3 companies per million people. Now, how is the sector perhaps spread out? We have what I would call pure manufacturers, and then mixed players or hybrid, and then the pure importers. And it's good to look at them in the segmentation in this manner, in that the pure manufacturers bring in what we call the active pharmaceutical ingredients, as well as excipients, and then produce all their products locally. The mixed players have naturally a mixed bag of both imported products as well as local manufactured. And then the pure importers are those who have perhaps licenses or agreements with a lot of the large pharmaceutical companies worldwide, from Pfizer to Sanofi to GlaxoSmithKline. And they tend to be the ones who also have the large pharmacies across in Ghana. So you might find in the large cities, you'd have chains ranging from whether it's from Unichem, East Cantonment Pharmacy, spread out. Then what you would also notice has been a natural progression is as the pure players or pure importers begin to get more stable and larger within the pharmaceutical landscape, they then work with the backward integration and get into the manufacturing. So what we see as hybrid or mixed players today, originally, a lot of them started as pure importers. The NS Chemists manufacturing site, for example, today, where they have perhaps the largest chain of pharmacies, as well as their manufacturing site, is a clear example of this. Now, how has health evolved in Ghana? And this is something that I think for a lot of us, we're perhaps experiencing more and more today, but it's interesting to note or look back. So if you were to take for the last 10 years or even 12, 13, 2007 to about 2017 in the top part of the slide, and then looking a little below for 2009 to 2019. Our top, say, 3 to 4 main causes of death has not really changed. We know, of course, malaria continues to be the biggest problem that we face in this part of the world, and it cuts across. And despite a lot of the interventions to actually reduce the malaria infections, and you can see clearly that there's been a drop. The magnitude of the problem remains the same, and this begins to stay as our number one. It's interesting also to note that even with like a 37% or 33% drop in malaria, for HIV having had a similar drop, it has enabled HIV, which perhaps used to be the number 2 killer, to come all the way down to, say, a number 6 for us. However, neonatal disorders remains a huge problem. Respiratory infections are continuing to plague us and even in certain cases rise. Then you will see that we perhaps have quite interesting parts of the charts that are beginning to be huge factors, which is heart disease. So 10, 15 years ago, stroke, heart disease, and diabetes were not as big killers, but the tremendous rise, over 20% in all of these, is a clear cause of concern. And it's even more important when you look at the 2019 chart to see that cirrhosis, which is liver disease, is also becoming an equally important factor. So in a clear case, we can see that with rapid urbanization, with some of the aging, and especially with urbanization and the different lifestyles that we're leading today, the same causes of death, which we're seeing in developed countries, are becoming our problems today. So if we switch over and walk into a typical pharmacy, and perhaps either in Lagos or Accra, and we're to chat with the pharmacist and ask what are the top 10 molecules or drugs that they actually prescribe, no surprise to see that paracetamol and artemether lumefantrine, which is for malaria, remains our top 2 molecules. So in effect, this clearly correlates with the information that I just shared about the malaria infection being the #1 problem that we're facing. But it's also good to note the incidence of perhaps vitamin C that are also prescribed for patients as well. And then surprisingly, something like diclofenac, which is for arthritic pain. So you see that this is coming strongly in both Ghana and then also in Nigeria. Then you have for the antibiotics and for infections, your metronidazoles, amoxicillins, ciprofloxacins, all also showing up as well here. So again, in terms of infections, it therefore means that yes, these are molecules that are being prescribed on an almost everyday basis in the pharmacies all across the different cities in our part of the world. But then comes again the part that is played by, say, something like amlodipine, which is then giving us the clear case that at the end of the day, we're beginning to have, for high blood pressure, medicines that have to be prescribed in order for patients to be able to treat that. So the amlodipines and the nifedipines are then becoming higher in then the top 10 molecules. It's also quite interesting to see how in Ghana, there is perhaps the incidence of herbal or alternative medicines that are also given out in the pharmacies or even as over-the-counter medications. Because obviously in our part of the world, and especially in Ghana, people have a strong affinity or trust for some of these alternative and local medications. In perhaps what's not showing, but it's clearly on the rise, is also other medications such as metformin, which is used also for type 2 diabetes and therefore correlates with the information that I've also shared with you. So perhaps just to get a little understanding of then how the pharmaceutical industry has come about, it's important perhaps to touch and introduce my company, Phyto-Riker. So in the bid to attain the self-sufficiency in our production of essential medicines, the government of Ghana decided in 1962 to set up a state-owned enterprise, which was then known as GIHOC Pharmaceuticals, or Ghana Industrial Holding Corporation. And that led to the birth of the first pharmaceutical company here in Ghana. The operations actually started with the factory opening in 1967, and obviously with further expansion and technology infusion with the German grant that was given in 1991, the factory then went on to become perhaps one of the biggest in the 1990s. With the privatization that the government then went through in the late 1990s, the company divestiture implementation committee that rose, the company was acquired by Phyto-Riker Pharmaceuticals in 1998. And obviously this has also gone through further changes to local ownership in the early 2000s. It's also good to note that the government still retains about 10% ownership of the company. And we were the first in 2018 actually to attain ISO 9001-2015 certification. We're going through a lot of changes at the moment, but in this light, you see that like most of the pharmaceutical companies within Ghana, we tend to have our medicines structured in line with perhaps the health needs of the population. So focusing especially on antimalarials, analgesics for the pain management, then also looking into, say, infections, vitamins, antihistamines, anti-infectives, the psychotherapeutics as well. And then slowly, like others, also beginning to look at perhaps offering others that will treat the NCDs that are becoming the problem of today. So, what are some of these challenges that are plaguing the pharmaceutical industry? For all of us across the sector is price of our active pharmaceutical ingredients. Most of these are imported and being produced in Asia. Now, if we look at even just last year, a simple API such as paracetamol, we were struggling with the fact that you had to have the special license from the Ministry of Health here in Ghana to also be given to the Indian Ministry of Health in order to grant the importation of a product such as paracetamol. And this actually was a change that arose from the obviously the COVID pandemic that was then in the height of 2020. But if we look at even just Q4 of last year into this year, that same particular API has doubled with 100% increase in price per kilo. This has implications on our local manufacturing business, obviously, because you cannot pass on all of these costs to your consumers and your patients in a one go. And it then means perhaps a tightening of business in order that you may not have your margins completely eroded. And obviously at the same time, the continuous depreciation of our cedi then means that even when prices are remaining stable on the world market, there is still for us a rise in the local currency. We've just heard very recently of rising freight costs, and we're seeing this from all parts of the world, but especially even with hikes of 50% and above for freight costs. It means again that there's even more pressure on the bottom line for most businesses. If you even look at things like energy cost, Ghana and Nigeria are paying, say, about 13 cents per kilowatt hour versus, say, southern countries in Africa who are at about 6 cents per kilowatt hour. Granted, we might be able to say that perhaps labor costs in West Africa might be a little better or cheaper than East and North Africa. However, productivity tends to be low, and this also has implications for business. Then, of course, comes the fact that the sector is one where technology and, in fact, being able to ensure that the research and development costs can be covered, that the manufacturing and filling standards that are upheld through aseptic and sterile manufacturing processes comes at huge cost. So there's a constant need for investment and expansion of our facilities, and you find that in this part of our world, and especially in Ghana, that there is very high cost when you're looking for finance for investment to do some of these activities. We're looking at anything between, say, interest rates of 10% and above on the cedi, say 3 to 4 is perhaps even the best you get on the dollar. And this in turn then means that by the time you turn around, you may or may not have the best return on your investment. Another critical challenge that I think we're facing here, and it may be a little unique to our business here in Ghana, and it would be interesting when we're sharing in this summit to see how this is addressed with other countries, is the fact that for most pharmaceutical manufacturers, their largest customer is the government. So for us, that would be the Ghana Health Service, and they are linked to what we call the central medical stores, who then buys on their behalf and then supplies to all the regional medical stores. Most of the procurement in this sense is done under what we call the sustainable public procurement, and then the framework contracting that has been put in place as a mechanism to guide pricing and to enable that the government can be, I would say, have stability in price from the manufacturers and then do their call-offs as and when. What tends to happen though is that even after there's been the call off or that we've actually been able to meet the demand medical stores, payments becomes an issue. Almost, in fact, all the manufacturing companies give to all our distributors, institutions, and even there are, say, private distributors and customers, at least about 90 days credit. So this is also what we're giving perhaps to the government at the end with some of these contracts. What tends to happen is you find, and this is, I think, as I said, in the spirit of sharing, that we then have late payments, sometimes up to about 2 years, where government has not honored payments back to most of the manufacturing companies. Obviously, this leads to very, very long cash conversion cycles. It then means even when payments are made, and naturally everybody says, yes, government will pay, but even when payments are made, that due to, say, depreciation of the cedi, due to all the other factors, that you've actually then put enormous pressure on the cash flows and liquidities of these companies, as well as they're reducing their margins at the end of the day. We also find that invariably, consumers or patients, perhaps whether it is because of, say, our colonial past and maybe because of also technology, have sometimes a greater affinity to what we would call, say, imported products. This can also be attributed to the fact that at times the local manufacturers tend to produce for institutions where, at, say, when you walk into our public hospitals, the pharmacies on site and the pharmacist will give out the drugs in, say, smaller packs without the patient information. So what they would be getting would be little or no information and perhaps a strip of the medicine. Invariably, therefore, at times, there might be a preference for imported, which they would find comes to in their minds with all the information. It's actually not that we are not providing the information is there, and we need to ensure that pharmacists do share completely all of this in order to eradicate or prevent this problem from the side of patients not understanding what they're taking. There's also quite a fragmented distribution channel at the moment within the country, simply because of, again, pharmaceutical companies doing their very best to cover all distribution costs and also to target all distribution points and different channels. So where you might find that instead of having good cohesive territory management where you might then sell to a one distributor who then will continue to channel to, say, wholesalers, semi-wholesalers, and then finally to the local pharmacist, most of the pharmaceutical companies on a demand basis will then actually try and supply to everyone within the chain, and literally at the detriment or to the high cost that comes with the delivery to all the different channels. So how are we trying to overcome some of these challenges? We're actually working locally with a lot of our stakeholders and ensuring that we can improve health delivery and achieve the sustainable development goals that are with us 3, 7, and 8. In Phyto-Riker, and like most of the other pharmaceutical companies, in 2016 and 2017, we had a collaboration with UNICEF on the development of oral rehydration salts with the inclusion of zinc. This is especially important for pediatric and for infants and even adults, simply because of the fact that it's been proven that with the inclusion of zinc, the recurrence of diarrhea is halted for at least 3 months, if not a little more. And this has been something that's been rolled out in many of the pharmaceutical companies. As well, in about 2015 to 2016, both the Food and Drugs Authority, FDA, as well as UNIDO rolled out here in Ghana the WHO Good Manufacturing Practices Roadmap to enable us to achieve manufacturing excellence. There are at least about 17 assessment criteria that go into this particular GMP guidelines. Everything ranging from ensuring that we have good quality management systems, our qualification and validation of finished products are at par with world standards, that we are also doing a lot of training, hygiene and sanitation, and that we have good practices in production and in quality control. As well, we've worked on various initiatives to address the, say, lack of pharmaceutical manufacturing skills with the introduction of the PharmaD program in industrial pharmacy by the Kwame Nkrumah University of Science and Technology, and to ensure that then we collaborate better with some of the research centers and offer our expertise in manufacturing to enable us to ensure that with succession planning, we will actually be able to have the manufacturing skills that are necessary for the continuation of our business. We've also, as a pharmaceutical industry, formed alliances and ensured that we actually come together as a body under the Pharmaceutical Manufacturing Association of Ghana. And this with PMAG helps to strengthen our voice on matters related to the pharmaceutical industry so that we can better perhaps partner the Ministry of Health in price negotiations for medicines, highlighting the importance of say, increasing the restricted medicines list, which today stands at about 49 medicines that are restricted here in Ghana. And we're hoping to work together to ensure that this is increased in line with the manufacturing capabilities and the medicines that we as the pharmaceutical industry can provide locally. If I take Phyto-Riker, for example, we're employing about 200 employees at the moment. And if you then even say that they are providing economic development for others, you can then say that we're touching the lives of at least about 1,500. Now, we estimate that if you put together all the pharmaceutical companies together, we're perhaps also then directly employing at least a little over 5,000 people, which could easily translate to 50,000 that are being impacted by the work that we do here every day. So 2020 was a year like no other, and I think it's important that we recognize that never, perhaps in the history of our lifetime, has there been one health topic that has dominated the headlines so strongly and for so long a period of time as the COVID-19 virus, which led to the global pandemic. In Ghana, for example, when this was also realized that it had come to our shores, the Pharmaceutical Manufacturers Association of Ghana was called with a meeting with the President of Ghana, and we were asked to support in any which way we could, and we continue with this support. So with the treatment guidelines that came out at the time, obviously, most of the companies then went into either sourcing procurement of hydroxychloroquine at the time, and also ramping up production, local production of azithromycin, vitamin C, and zinc. We see as the time has gone on that right now there is talk of, say, vaccines that as Government of Ghana and Ministry of Health is looking into the procurement. As pharmaceutical companies, we remain quite open to further our support in whichever way possible, whether it is even with form and fill to actually then have, say, vaccine local production. But what I find also that is actually exciting is the fact that as we're going on with supportive therapy here, we have to also be looking at various ways that this can be done. And just recently, this February, clinical research is ongoing with the Kwame Nkrumah University of Science and Technology into a local medicine which goes by the botanical name of Cryptolepis sanguinolenta. And this product is actually on sale as well as a, call it a plant medicine, which is with the Mampong Research Institute for Plant Medicine here, and was actually produced by Phyto-Riker, called Phyto-Riker, at least 15 years ago. So we obviously are quite excited to see this clinical research, and we'll wait for the results, because it's important that as vaccine technology is rolled out, that we begin also to look at various ways in which we can strengthen the supportive healthcare within our nations and have affordable medications that can help in the COVID crisis. As well, there was also the call for improving hygiene, because in this particular virus, and it's highlighted perhaps some of the issues we have in sanitation and hygiene here in a lot of our nations. Most of the pharmaceutical manufacturers went into the production of hand sanitizers. We today produce both liquid and gel hand sanitizers. And I think it's also important to recognize the role that other industries have played in the production of PPEs and gloves, disinfectants, and nose masks right across, that has enabled the industry to actually develop quite rapidly and for us to become a little bit more self-sufficient. So what is in the future for the pharma industry? I think one thing that is extremely important for all of us is the African Continental Free Trade Agreement that has come in place and started here in Ghana. And we're expecting that this will help to increase our export to varying countries. The 22 countries that do not have pharmaceutical base, as in manufacturing base, can definitely benefit from their local manufacture in neighboring countries such as ours. But even more importantly is for us to also look at perhaps the sourcing or procurement of, say, APIs, excipients, and even packaging materials from neighboring countries. I know that Nigeria for a long time has been looking into the production of, say, alufoils and PVCs, which could be an important development for us, because this is something which we also import from India at the moment. We're also looking to strengthen some of the partnerships that we already have in place and have more and more technology transfer. As we look, as I mentioned, in terms of the vaccines manufacture that is happening either with, say, Pfizer and Moderna, or even with Oxford and AstraZeneca continuing today, we need to be able to say that within Africa, form and fill of, say, vaccines locally. And this could help us as we, as most African countries, also transition from Gavi and have to become even self-sufficient with other vaccines that we need locally as well. Of course, this will not be able to be done without the key financial investment into technology and into our industry that it will take to ensure that we can leapfrog and be able to actually match what is being produced elsewhere. This is something that we know we have the expertise locally in terms of the manpower resource, but we would also need the industrial expertise to go along with it. As I mentioned earlier, collaboration with our research and medical centers is extremely important to us and will enable us as time goes on and as they understand better some of our local and fantastic plants and medicines that we have, to be able to translate some of these into commercial products. What we need is to complete the medical research that is required and also have the bioequivalence data that will ensure that we actually know the efficacy of these medicines. And then the commercial production is where we come in to ensure that we can have affordable, unique products that match with the needs of the African consumer. We cannot do this alone, but we also need to ensure that in that partnership, government remains a key stakeholder in ensuring that we have the right environment. Some of that has been done already. I know in Ghana here, we enjoy some duty and tax and exemptions, but perhaps we can look at how to ensure that this is even taking a step forward, whether it is in key funding to ensure that, yes, we can actually acquire some of the capital needed and ensure that even the facilities that we're given are at a reduced rate. Again, grants into research are important, as this kind of development is something that we lack strongly here in Africa. And then also to translate that into some of the skills training that will take us into the future and the pharmaceutical world of tomorrow, so that we, and especially in Phyto-Riker, can continue to offer quality and affordable pharmaceutical products and services to meet the needs of the population of Africa. And now, just to end, perhaps, I would like to share with you a short video on how the Ghanaian consumer understands health and well-being and how we are helping to ensure that they can take this and we can support them in their healthy lifestyles.
Our daily moments are filled with choices and actions that affect our health and ability to function.
I came to Accra for working. So I work every day, no tiredness because of exercise. I do every day, going jogging. Morning time I go jogging. If I come home, I make press up, squatting, a lot of things where I did.
My day begins from 5:30. I do fresh up. After that, I hit the ground by 6. I do running for 30 minutes and 30 minutes warm-up exercises and yoga. And by 9:30, I do take my breakfast. And my breakfast, which includes some eggs, salads, and there'll be some milkshake as well, and which help to maintain my diet and nutrients.
I used to take certain things for granted in my life. I was someone who was very indisciplined when it comes to healthy lifestyle. But I had a shock of my life when one day I went to donate blood at the hospital, and the nurse told me, it seems you are even closer to death than the person that you are donating blood to.
Our desire for a healthy life often has a direct link with the lifestyle decisions we make.
So I've taken the conscious effort to make being healthy a lifestyle. So in a day, what I do is I wake up in the morning, I try and hit the gym first thing in the morning. Then I head back home. We're working since, during this era of COVID, I've been working from home.
So personally, I decided to embark on a certain process. I started with walking. So I had an app on my phone that was calculating the number of steps I take every day, my cholesterol intake, my blood flow. So I realized that after that period, my visit to the hospital in terms of the checkup and everything was more positive compared to the previous times when I wasn't exercising, I wasn't really taking good care of myself, I wasn't really eating well.
foods we eat give us key vitamins and minerals like vitamin C and zinc for health and immunity against infections and diseases.
Kenya na we bi ene wo me wole meji wo draw free wo ya wo wo fi exercise bo nu no le fat mo wo na e wale wo ye ni bi keke wo yo kete sile mi gen yo mo so ne me yo komi be ke me gen na tampi koko alo ye ko tu ken ye gen awo wo fit mo da gbogbo ẹ̀sùn wo nu da wo shan wo ye asala.
Other measures that I take to ensure that I'm being healthy is I try to do that through my meals. So in the morning, I would try and have something that's nutritious. So by that, I'll probably have some oats and balance it with some fruits. And I always try and have a high protein breakfast because it's what keeps you fuller for longer.
I come here to buy food, either rice or wache. I'm a footballer, so I do play ball on the weekends just to keep me fit.
Moduna akodu, alo mango, alo atoto, alo adiba. Lu suba no naba nya edomana bobo nwi, na ma yito ma yira ngodoa, na ma adafo nwi. Enyu wi oke mo wona. Da na na pu aba ga ewo mogoji a, metendu nan wo kenye modu na nwa heavy, modu na sui, gasha ga na ma du nwa, modu na osu na gbo. That one, if I work, I know to eat plenty. That will be let me be lazy.
I take late lunch by 5 p.m. and before hitting the bed, I take a cup of milk, boiled milk with the garlic.
Ni ne ko aye ni keke ke oye ni le bi esa no me o me tumo 12 ni o so oye ni ko ske o fila ke bo ni no ye keke e ba gbo na aye ni da kan be keke o na drink no nupo je no ko e ba yen wabu fenu ni wa ye komi alo wa ye gali alo o ta ni ko ni emi chin le ba ni ona musu.
The body does not store excess zinc and requires it regularly from our food sources such as poultry, fish, red meat, crabs, and oysters.
I do take in zinc tablets and vitamin C in order to boost my immune system. You don't have to wait to fall sick before you exercise. Exercising is good. It helps in circulation of your blood. It helps prevent strokes. It helps you to keep your body fit.
So if I finish, sometimes I take zinc. I take zinc that make me to give me more health.
Actually, I take zinc to boost my body to play the basketball. We have to take exercise more serious in our life. You have to wake up in the morning, jog, do some small training.
During the day, to keep my immune system boosted, I like to take such supplements such as zinc and vitamin C to help boost my immune system, especially during this era of COVID.
Corona war, no fear exercise. Ona, no body me. If you clear, no ko small vitamin C. Me can call zinc. I zinc can call and I can na wala me. Once more zinc. Can you buy a fruit and you akutu? Akwaru can be, but from make can be no anya wow. Maybe I should sell the wow.
Modern living and poor eating habits deny the body its daily nutrient need.
I believe that if you want to really take good care of yourself and prolong your life, you have to take in more vitamin C, more zinc, exercise a lot, and also look at your food intake.
Zinc is the second most abundant trace mineral in the body after iron and supports growth and repair of body cells, growth hormones, health of the brain, testosterone, insulin, estrogens, and cleansing of the liver. A healthy lifestyle choice of the right nutritious diet and regular exercise enriches the totality of our lives and well-being. Make the right lifestyle choice.
Thank you, ladies and gentlemen. Over to you, Adam.
Thank you very much, Mrs. Yamson, for that presentation, which sort of sets the tone excellently for today's discourse. So before we go on to the next speaker, I would like to say that the presentations that will be used during the summit will be made available to the participants after the event. We'll share with you all via the email addresses that we have. We'll also upload these presentations on our YouTube channel, and we'll also circulate via our monthly newsletter, which is widely read around the world. If you have any questions, kindly ask through the Q&A chat box, and I will ask the presenter while the presentation is going on or after the presentation. Although after all the presentations, there's going to be a separate Q&A room, but sometimes it's important to ask your questions as they pop up so you don't forget, or so that we don't, the speakers are not off the platform before we're asking these questions. We've been joined by the Honorable Senator Mutahi Kagwe, Cabinet Secretary for Health of Kenya, but you would notice that we skipped his keynote address, and we'll skip it again because the Honorable Senator has requested that we have the next presentation before he joins us. But we're really honored to have your presence, Senator Kagwe. We'll also have a little change to the program itinerary because the next presentation is going to come from Mr. Kyle A. Saki, who's the Deputy General Manager of GCNET. His presentation is going to be on the topic information security in the healthcare industry. Now, before we move on to Mr. Saki, I would like to say a little bit about who we are. We are principally a trade and investment promotion organization. We've been working in Ghana, trying to deliver prosperity through trade for the past 10 years, and we're part of the global network of World Trade Centers. There are 338 World Trade Centers around the world in over 100 countries, and we are networked in New York. Our principal objective, as I've said, is to promote trade and investment into Africa, and we have worked hard over the years to promote Africa as a preferred destination of investment for business people around the world. We have several key programs and initiatives, one of which I would like to touch on, the One Africa Initiative, which is an initiative of the World Trade Center Accra to connect businesses across the African continent. And from this year, I think in March, we're going to start visiting other African countries with business delegations and government delegations from Ghana. We'll visit them in clusters, and so in each cluster we might visit 3 or 4 countries at a go. And so to all the members of the audience from across the continent, very soon you'll be receiving delegations from the World Trade Center Accra visiting your country. And the objective of this will be to connect African businesses to get us to start working and trading with each other. I would now proceed and hand over the floor to Mr. Kyle A. Saki from GCNET. Mr. Kyle Saki, kindly take it over from here.
All right, so what's the time now? It's good afternoon. Yes, it's 12 o'clock. Good afternoon, ladies and gentlemen. Good afternoon, Honorable. And thank you for having me on here. My topic is slightly different, information security in the healthcare sector. I'm the Deputy General Manager for GCNET, but I'm also the president for an association. It's called ISACA, Information Systems and Audit Control Association. I have a lot of acronyms down there, but they're all security, cybersecurity, audit, risk certifications. So I want to start with this. Clearly, the health ecosystem back then and where we're going currently, it's very different. So you have all the interlinkages between the universities, research organizations, the pharmaceutical industry, as we just got a presentation. You have the government agency, hospitals, and now you have the tech sector actually also interacting with the healthcare sector. And all these things put together creates an interesting situation that brings about the need to have a conversation on information security regarding the health sector. The landscape has changed, and now you're actually moving from a situation where it's physician-centered to more patient-focused. And so you're having all these specialty type of services where you have direct contact with the physician. Some are using chatbots, some are using artificial intelligence to be able to do some sort of diagnosis and come up with a recommendation that the physician works with. The other thing that's happening is that we're becoming socially connected with our healthcare industry, starting with things like the IoT, the devices that we're using. And so people come up with the smart watches, for instance, and phones, and they go for walks. And then you have a group of people beginning to connect the dots and looking at what is happening to each and every one of them, how many kilometers they walked, and so forth. I was reading something where, you see some of the devices now, you suffer a fall and immediately send an alert to a doctor. So the healthcare that we know, that we knew in the past, is very different from what we have today. And all these things create opportunities, so there are the pluses, and then there are also the disincentives to it. Now, in the past, when you had to have a connection, you had to physically go to the hospital. It's no longer the case. In some of the new things, I saw one app on the Apple Store, for instance, and on the Android Store, 24/7 online. And you register and you have 24/7 access to physician services. I'm still trying to figure out all the players behind it, but that's the way where we're going now. And it creates interesting paradigms for all the players. So the pharmacies clearly would also have to get to that level where they're also working 24/7 and dealing with the hospitals, ambulances, and you have a very engaged ecosystem that creates the opportunity. Okay, and I use the word advisedly, creates the opportunity for cybersecurity breaches and for security incidents if the necessary care is not taken. And so from the healthcare perspective, I think that we look at three things, and that's always been at the back of the healthcare industry. First, you're looking at the privacy issues where we focus on the patient's right to be left alone and the right to keep personal information security secret. Now, if you go to a lot of the hospitals here, okay, sometimes you wonder whether this is really the case, because you find people handling files, and so some of the hospitals are now automating and coming up with systems that would ensure that these things are handled properly. But then that also creates the challenge where if you look at the education, how readily or how much training is given to the healthcare professional and also the individual, so the patients, as to what information they should give out. So that's another thing that has to be looked at. Then you come to the confidentiality bit, which from a healthcare point of view, the focus is on how much information has to be shared. What do we disseminate, and who needs to know this information? And then the third anchor for the healthcare side is the mechanisms that ensure safety of data and systems. And that tends to focus purely on the IT side. But then it is not only IT, because you need a trained and well-resourced IT to be able to get these things done. And that is where we have a big problem. And I think that we will speak to that briefly. Now, from an information security perspective, we look at this differently. Information security looks at the confidentiality of information. We look at the availability of the information, and we look at the integrity of the information. Now, you have disparate systems. And so if you want to look at the confidentiality, then the focus is on making sure that information is not disclosed to unauthorized individuals, which is not too different from what you have from the healthcare perspective. Okay, but then we also have a strong focus on availability. So if we move into systems where now you're beginning to see, let's say the Kolebu Teaching Hospital has come up with an automated system, the health management system. We've seen different hospitals also trying to do the same thing. Then you want to ensure that all these systems are available as and when they are required. And so a patient goes to the hospital and the services should be able to deliver the services when and as and when the patient requires it. A doctor requires information, needs to do some further work, the systems should be up for him to be able to do the work. And then integrity is important because you want to make sure that the data is not tampered with. These three things, we need to look at it, from the information security perspective, but also look at the needs of the healthcare the professionals. And that is what we want to look at today. And my reasons for putting it there is because the healthcare industry is highly regulated. Unfortunately, we have a serious lack of robust information security management programs. And that is very true. Today, if you compare the healthcare sector with the financial sector, with the telcos, the investments that is made in these sectors is way more than what the healthcare sector invests in technology in particular. So we're investing in, we're investing in the financial sector. They built all the beautiful security operating centers to ensure that they're able to detect breaches, they're able to control who has access to what information. But unfortunately, the corresponding investment has not been done in the healthcare sector. The other bit that comes into play in the healthcare sector is that it's highly dependent on new technologies. And you find out that a lot of the hospitals, you probably find different technologies coming into play. So you have a conference and a particular business entity comes to demonstrate or showcase a particular technology. The hospitals are quick to adopt it. But then we do not look at the linkages with other systems that you have in there. And so what it creates is increases the attack surface, what we call, it makes it very easy for the hospitals to have gaps that people can exploit in breaching the technologies in there. And then one of the most important things, okay, and so it has both a positive and a negative side, the dependence on the human aspect of things. Week after week, we get reports of data breaches that are impacting hospitals. And this takes place year on year. I mean, if you look at the recent trends when it comes to the pharmaceutical industry and the rush to come up with vaccines, there have been many attempts or there have been many breaches that have taken place simply because you have people trying to get to see the data that goes with the research that has come up. Hospitals have been breached in the US where there have been ransom demands for certain amounts. Same have taken place in Europe, same have taken place in Asia, and we have some that have taken place in Africa. And when you do the diagnosis, the weakest link has been the human element because not enough training has gone into that side of the chain. And so the need for information security, that cannot be overemphasized because security is what keeps health records safe. And so if we are moving to the stage where, particularly in our case in Africa, where we've seen a lot of change, we've seen investment and we're getting the very upward mobile environment, and you actually see the rise of tech companies coming up with all sorts of systems that would engage with the healthcare sector, then clearly one of the conversations we should be having is the need for security. And Gustin said that no security measure, however, can prevent invasion of privacy by those who have authority to access the record. And that is where we need to draw the line. How do we educate people so that people know what is right and what is wrong? The second thing we need to know is that the health information is actually priceless. If anybody breaches a system, a financial system, and you take a credit card or I use a credit card for instance. Credit cards are time bound. So after 2 years, 3 years, it probably expires. But health record doesn't expire. And so people have this type of information and they can use it for whatever means that they want. And that is why we even need to spend a lot more protecting the healthcare sector. And the players in the healthcare sector that we should be worried about are organized crime. You have the activists, and then you have cyber thieves. These people are looking for all the information that they can get. Interesting enough, here you go and you see people exchanging a lot of files. You see documents lying all over the place. Clearly, we've not been conscientized enough to know how important all these pieces of information are and need to be protected. And so I'll pick a quote from Meredith Phillips. She's the Chief Information Privacy and Security Officer at Henry Ford Health System in Michigan. And she was speaking at the 2016 the network conference in Philadelphia. And she said, and I like just the last, is that when you get on the phone with a patient whose information has been breached and hear them cry or how they feel violated, that is not a piece of data, it is a person. Because every information that goes out actually touches a life. Lives are lives cannot be replaced. So for us, the practitioners, the technology practitioners, but as well as the healthcare professional, these are the things that we want to focus on. And that's why we believe that we want to focus on what affects the human being, the most important elements that we want to consider as a human being. Of course, the data we generate from the systems is important, but it is important because it affects a human being. And so I'll give you some history on some of the breaches that have taken place. If you look at the Harvard Business Review, this was a 2020 report, and you see exactly the trend. It goes up every year, the numbers increase, especially on the hacking side of things. Last year, you had in excess of 20 just hacking or IT incidents globally. That is a lot, okay, that have taken place. A lot of records, a lot of individuals who have been affected. But then if you come back to the US and you pick the HIPAA journal, which is the HIPAA looks at the US, the privacy information. And what they noticed, if as of August 2020, we had 2,167,000 distinct breaches, health records that had been compromised in breaches. That is significant. Now, just the statistics from the US and from the advanced part of the world. But then here in Africa, we have one from South Africa, Life Healthcare. That's the only one, a lot of breaches are not reported here, unfortunately. Life Healthcare's system was breached, and it was breached through an email. Obviously, it was a phishing attack, and phishing in the sense that, and I'm sure you know, people get all sorts of emails where you see them, and we are so eager to click on a link that doesn't make sense. And that's simply because not enough education is done. And somebody goes through to the system and they managed to look at all the records. And it went as far as compromising the email, but then going to the business process system, assessing all the inventory, looking at patient records, and so forth. It was a big thing that took place, and the effect of it is still being felt. Clearly, these are not the only breaches that have taken place. A lot have taken place. And so it calls for us to have a good conversation as to what we need to do in the health sector. How much do we have to invest? What the legislations do we have to put in place to ensure that all healthcare players in the healthcare sector are playing according to certain standards and the minimum guarantees that we'll have to expect from them? And so from the way I'm a tech person, and so we try to look at things from the building blocks. The future of health information systems as we see it, we're moving from the traditional net information monitoring, all the disparate systems, to what we call the strategic information systems. And these systems are largely underpinned by artificial intelligence. And you see the rise of some of these things taking place. This morning, I read a report which said that, the Apple Watch and then the Samsung one, for instance, are able to quickly detect the onset of COVID before the patient is aware. So, and that is largely being done by artificial intelligence. And so hospitals, for instance, are making use of that information. But then who else is making use of that information besides the hospitals and those who have the good of humans at heart? And so it creates, it brings about the need for us to think of the protection of these systems. Then you have the building, the tactical information systems, how we deal with it, and then operational systems, which is the patient records, payroll, and then the inventory, and so forth. Now, today in Ghana, we have a healthcare revolution. It's gathering momentum. It's the same thing is happening in Nigeria. I've seen some records. In Kenya, for instance, there you've seen the same type of thing taking place, where we're moving. And the video that Mrs. Yamson showed, clearly you could see people beginning to count the steps and watch what they're eating and so forth. And it is all from these things that we have, the sensors and the devices we have, the fact that we have connectivity, you have social networks in place, and you have the internet available. Now today, everybody has some sort of pharmacy on their device. You can quickly go and look at what medication you are taking and so forth. And all this information gets fed to systems, going to doctors and so forth. We have institutions here that are beginning to do that. But what you don't see is actually the concerted effort at making sure that we have proper protection of systems in place. And so we're moving very fast in trying to develop the healthcare sector, but we do not have the same pace of development when it comes to the protection of the information that goes into these systems. And this quote actually aptly makes the point that the healthcare providers typically do not use the same high levels of security technology as companies in other sectors. And this was from the FBI. Now, all the breaches that have taken place actually confirms that the protection that we have in the healthcare sector is not at the same level as you have in other industries. It is time for us to start making that investment, but that investment can only be made if we have the leadership. And so here I'm talking about the government, so Ghana Health Service or Nigeria or South Africa, whichever institution is responsible for that, working with the legislature to put in place the necessary bills. Indeed, in Ghana, we have the cybersecurity bill that has been passed, and that puts in place some of these things. But we need to go beyond it and look at specifically the health, something for healthcare information security bill. And so what I advocate, the way we should protect our information, the healthcare information and the systems that go with it. And I try to differentiate the two. First, we need to look at some type of HIPAA. I use HIPAA because that is the most, most well-known. Of course, you have the high-tech, there are other ones, but I use HIPAA for the purpose of today's presentation. That HIPAA is focusing on privacy. And so we need to look at the proper privacy protocols and implement them in their organizations. And this is very important. We are doing all these systems and we're collecting so much information, but we are not looking at how to protect the information. And so that's the first bit. The second bit is to look at the technology side of things, because the privacy alone, HIPAA alone, from the professionals, HIPAA does not make the grade when it comes to protection of information systems. It doesn't focus so much on the technology side of things. And so healthcare providers, so the hospitals and the technology providers, the service providers, that interface with the healthcare institution need to get certification in ISO 27000. So ISO 27000 is the information security standard. So that's the de facto information security standard that most organizations have. For quality, you have ISO 9001, which Mrs. Yamson talked about. But if you're doing information security, we look at ISO 27001. And so that standard would have to be put together. We need to have a privacy-specific standard that we'll look at, either from adopt HIPAA or any of those other ones. Will come up with a version that suits us. And then we need to adopt technology security standard, so ISO 27001, where you focus on looking at the risk. Today, who has looked at the risk of the information sector? Let's say you pick any of the vendors that is providing some of this newfangled technology, diagnosing patients and collecting patient code, who has looked at what is happening and how the information is being treated. I don't think, I haven't seen any such information. I believe that we need to get to the stage where we enforce it. The financial sector in Ghana has actually come up with the cyber security directive from the central bank. And I believe that the health sector will need to do something like this, which mandates all institutions that are processing information to have standards like this in place. That's the only way we'll be able to protect the systems and the information that goes into them, the information of the patients and their healthcare records and so forth. But then it also protects all the other parties that are involved in the process. So nobody would want to be able to see what information, for instance, you're getting from Phyto-Riker or AstraZeneca or so forth. These are things that you want to keep private, except what needs to be made in the public domain. So we need to have this in place. And then going beyond that, we need to adopt a framework. And this is one framework which I like. This is a pure technology framework, but I try to use this. It's easy to understand, where we have to do what we call assessment, the technical review of all the touch points. And so if I pick any of the vendors, so I go to a hospital, for instance, you should walk through the entire process and see all the different touch points, who has access to the information, and then look at the technologies that are in place with the vendors and so forth. And we try to do the gap analysis, and this is something that needs to be done year on year. So there have to be periodic audits just to make sure that we are keeping the systems right. Because, you know, when you look at the cybersecurity platforms or different forums, they tell you Africa is supposed to be the next frontier. Next frontier for what? You know, clearly we know there are a lot of vulnerabilities here. Nobody knows what is happening. Even if it does happen, we do not report it. But we need to get to that stage where we know what takes place on our systems, and we are able to have proper remediation and response mechanisms in place. And so a framework like this, I believe, is very important, where we have an architecture, and this is supposed to be legislated, and governments would have to do it. It's not only for Ghana, it's not only for Nigeria, not for Kenya, it is across the continent. We need to be able to get to that level of maturity where we can predict how our systems work, and we are able to have a hand on the pulse as to where information goes to. That needs to be done. And we focus on what the vendors are doing, vendor assessment. A couple of weeks ago, there were breaches that took place here in Ghana through third parties to the financial sector. And that's because the financial sector has the systems that are able to report on these things. And so it came up in the public. But then who knows what else is taking place in the healthcare sector? We don't. And that's because the systems are not as mature as they are in the other sectors. And so my recommendation is that we need to do a lot of the investment in this type of things. And the healthcare sector needs to be able to, and I'll repeat it, let's ensure that we have the framework in place, the standards that are in place, minimum requirements that every institution, every player needs to work with. It's not just about quality, it is about making sure that we're protecting the records of patients, but the records of the companies as well. And so this is the framework that I was talking about, information, the ISO 27001. And the reason why it is very important for the healthcare sector, we have security policies. Now, the breaches that have taken place in the healthcare sector, some of the reports is because, you know, we do not have, like, let's say, encryption policies for devices. And so you walk into a hospital, and for hospitals that are even using electronic devices, you can find a tablet just lying there, and the tablet is not encrypted. And so if anybody picks that device, they immediately have access to the system. That is not supposed to happen. When we bring connected devices into the hospitals, who looks at how to ensure that we're changing even the default passwords? You know, a lot of them are still using default password. So if we don't go to the next level and ensuring that we have security policies in place and an information security program in the organization, then these defaults would happen, and it makes it very easy for people to breach the system. And then the third thing, if you look at asset management, at least it is important that, let's say, and I'm going to use Ghana, for instance. If you take Ghana Health Service should have a complete asset register of everything that they have in the facilities under their jurisdiction. And so Ghana Health Service should be able to pick the asset register and know that I have this equipment that is in, say, Kolebu Teaching Hospital, this equipment probably end of life. These are the bulletins that are out on this equipment. So it's telling you the security vulnerabilities of this equipment. You know, that type of thing is where you have a systematic way of checking everything that you have, helps improve the security posture of the organization. And then the HR point, which is the HR script, the fourth pillar, is such that we start creating the awareness. And so you train each and every individual in the organization, right from the chauffeur, the driver, to the CEO of the organization, goes through information security training and creates the security culture in them, and then they become very conscious of how things are done. There's no point in walking to a hospital and then you just be behind the computer and you can actually see all the records there, because people do not even know that when I walk away from a device, I need to lock the device so nobody would have, no unauthorized person would see the information on it. Then the fifth bit is looking at the physical and environmental security. That is also one of the things that is under information security that tends to not be available in a lot of facilities. So the whole revolution depends on us looking at privacy and information security as a whole in its totality, and ensuring that we push and we legislate it, make it compulsory, and then set timelines for improving or bringing all systems up to the same level. And it moves all the way through to having a compliance function in place where the regulator is going to be auditing the systems on a periodic basis, so you can get consultants to do this type of audit. This is what I believe is missing. It's missing in our part of the world, in many countries, and stuff that we need to do. We can do it and with the necessary investments. This investment, yes, it's not cheap, but the benefits far outweigh the disbenefits. Now, and I'll use the case of the COVID, for instance, where we've seen the Kwame Nkrumah University of Science and Technology, other institutions saying that, look, they're coming up, or they've seen they're developing vaccines. That is stuff that needs to be protected properly. Now, if you imagine not having proper information security in place, then clearly any attacker, anybody interested in the research data or all the ingredients, clearly will find a way into the systems, breach it, and then by the time you're done, you've done the work for the attacker, who probably has access to other players with more sophisticated systems, and they can quickly bring the same vaccine onto the market even before yours comes out to the market. And so the protection of intellectual property becomes important, and this type of framework helps us to get these things in place. And so to round up, I believe that it's in our interest. The goal of all of us is to have a secure healthcare information system implemented. I don't want to know or nobody wants to see the healthcare records of the president of Ghana or Sierra Leone or Kenya, for instance, or you don't want to see the minister's information out in the public, or the relatives of a minister in public, or just any other individual. You want to make sure that everything is done properly. And so we're advocating for systems that requires authentication. So authenticated users are people who we verified and put into the system, people who are authorized to have access to the system. And then we have a way of auditing what takes place in the system. The next thing is to look at the cryptographic protection. Healthcare records are important. We should not just leave it anyhow. I think that a lot of people are moving from paper to digital, but then what do we even do with the papers? We sometimes, we just simply destroy it, and people have bought granules and banana, and they've seen the healthcare records just like that. Then we go to the point of de-identification, where I can pick the data, but I don't know who it belongs to. That is a very important thing to do. And the final one is to have security metrics that we can measure. And that is only possible if we adopt the standards I talked about, like from the HIPAA or a variant of HIPAA that suits us, and then the ISO 27001 standard. So I'll end with this. It says the health sector is in desperate need of a cyber hygiene injection, and it's very true. And if you prove yourself and you go around our health facilities, yes, a lot of progress has been made. Hospitals are automated. You see a lot of technologies coming in place. You see the private sector coming in there, but it is not enough. We need cyber hygiene injection, and the time to act is now. Thank you, Mr. Chairman. Thank you, ladies and gentlemen, for your attention. And so these are some records for you. Thank you.
So next up, we're going to have the Honorable Senator Mutahi Kagwe from Kenya, Cabinet Secretary for Health of Kenya, addressing us. I'd just like to say that I think one of the main realities that we have become aware of due to the COVID-19 pandemic is the need to strengthen our local healthcare systems. Because, you know, in this COVID-19 crisis, nobody's been able to travel outside of the continent to seek medical attention. Everybody's here. And so generally, we need to, as you have stressed, protect the information of everybody that's seeking health care on the continent of Africa, especially for key decision makers and even for government officials and so on, because that information can be used to cause chaos if it falls in the hands of the wrong people. So thank you very much, Carl, for stressing this point, and I hope that the point is well made. Okay, I am reliably informed that the Honorable Senator has asked us to move on to the next speaker. And so I would like to take this opportunity to invite Dr. Francis Smart, Director of Policy Planning, Information and Ministry of Health and Sanitation of Sierra Leone, to take the floor. Dr. Smart, if you are with us, kindly proceed. Thank you.
Thank you very much. On behalf of the Ministry of Health and Sanitation, we want to thank you heartily for getting Sierra Leone on board. And let me start to say that this was delegated to me by the minister. We have some transitions. We had the previous minister, he has now been transferred to another ministry, and there's an incoming. And the interim, we had a minister, the first deputy minister, who was acting. And so he asked me to step in his stead. This is important because I would like you to keep to the communication channels. I know you went through the foreign affairs, and so you will give feedback to the country, to the ministry specifically. That being said,
sure.
So you will see the map of Sierra Leone, and you will see Sierra Leone has borders like Guinea, Liberia, and we talk about the Mano River Union here. We have Cote d'Ivoire on the other side. Now, of course, you know, all these countries have been in turmoil, I mean, fragile countries, and you can understand what the situation will be like in such circumstances. Sierra Leone had, so you go to the next slide, please, has survived series of landmark circumstances. One was the Civil War, and the Civil War started in 1991 and ended in 2002. We had also cholera outbreak in 2012. In between that, there were other small hitches or PVLs, and the Ebola virus disease, which we all know about very well, 2014 to 2015. And the flood, we also had flood, 2015 and around 2016 also. And then the mudslide, this was on a bigger scale. We used to have smaller ones, but the bigger scale. And then and we have COVID-19. So the point I want to make here is that all these upheavals we've had in the past have demand on the health systems. So you will see that the medical school that we established was just 2 to 3 years old when the war came in, and you can see the devastating effects on both training and also the human resource that we had. In fact, we have on record that we lost up to 70% of the infrastructure for health. So that is the basis. But notwithstanding, we survive this, and you can see that the health results we have been getting, the health outcomes and impact, immediate outcomes and impacts. For fertility, we have improved fertility considerably. And you will see our demographic health surveys. The first demographic health survey was conducted in 2008. It's all out after the war. And you will see and compare for 2013. And then the most recent one, 2019, which we conducted. And you have seen considerable drop from rural, of course, the total, and the urban. I give this as strategic information, so I won't bother you so much with details, but I just want you to see that we make some progress. You look at nutrition, we have also made some progress with reference to those 3 demographic survey reports. I mean, you see the stunted, how stunting moved, and you see also underweight and wasting. And you look at in terms of malaria, I saw malaria in the Ghana presentation is #1. So it is in Sierra Leone. Even when we have made considerable progress, it still remained from 2007 to 2019, is still #1. But indeed, we have made considerable, and some proxy markers you can see is the ownership. You can see the considerable changes. For HIV, we also made gains for HIV, and we stayed at 1.5 for a long time, and the recent 2019 GIHOC shows that the prevalence is now 1.7, which shows concern. I saw for Ghana, HIV was #2. Ours, HIV is not #2. I think it's around #5, #7. I think you are doing some work today. But anyway, I can see from other computers, so I see you. So also, you look at the child mortality, you can see we have done well with the under-5 mortality. That was at 140 per 1,000 live births. It went up a little bit. You can see the effects of what I presented, the context in the red. I mean, you can see in the middle, almost all the 3 indices we have there, they went up just immediately after the, just before and after the Ebola and those other issues I made mention of. But we have made considerable progress since that time. You will see the infant mortality is now at 75, and the neonatal mortality. Same for maternal mortality. Our country, my country, is known for having one of the highest maternal mortality ratios in the world. When we did the first demographic health survey, it was 857 per 100,000 births. And it went up considerably in the 2013 GHS reports. But now we are back to 717, and we are making considerable progress. This is the type of results. We have also other sources of results that will show that we've made progress. Next slide, please. Next slide. So for the next slide, we'll try to show one of the successes. The successes here is the way we are managing the COVID pandemic, but for us, epidemic here, and you see we made considerable gains. As I speak so far, I know we have 79 deaths. The deaths are problematic, the way the classification, because we have issues. Every country has issues with the classification of the deaths, but we have considerable gains. You see our phase 2 is now under control also as I speak. We have successes around the National Emergency Medical Services. And this is one area. We have over 168 ambulances in country, and over time from 2019 that we operationalized, was launched first in 2018, somewhere just after the elections. We have saved over 30,000 lives, and this predominantly lives of women and children, the most vulnerable. You will see also, not very clearly, forgive me, but you will see other results as depicted from the malaria scorecard. So they have looked at, it's not only malaria scorecard, but the R, reproductive and child health scorecard. So we've made considerable progress in terms of malaria, in terms of immunization, and in terms of child health also. You can see basically there's a smaller graph there, and there we are looking at our process indicators. So you will see that facility delivery has considerably increased up to 87 from around 40 or so before. And you will see also skilled birth attendance has gone up considerably. I will hasten to say that even with that, with those process indicators improved as outcome indicators, you still see that the impact, that is the maternal mortality ratio, and those infant child mortality and 5 mortality are referred to are considerably high. But banking on the context I just presented initially, you will see that we made a lot of gains. You also be aware that we introduced the free healthcare initiative policy. We learned a lot from Ghana over the years. The challenges we had were around the medical supplies, the human resource, and health information. So around these 3 challenges, we've made considerable progress. You will see, for example, here, that was our former minister, Professor Alpha Uri, and then the HE, the president of the state himself. They put mechanisms in place to deliver free healthcare drugs, because that was a serious challenge, as I've mentioned. By Act of Parliament, we established the National Medical Supply Agency, and then the board is now quite functional and is autonomous, and that is really bringing effectiveness and efficiency in the distribution. So for human resource, the government, the current government now, there was moratorium on recruitment, but they recruited 4,000. That recruitment is almost complete. And then for 2021, we've been given 3,000 more recruitment to do. We have around 15,000 community health workers, and a lot of progress is being made in the local training of mid-level healthcare workers. And there are ongoing training, both international and local. But for international, over 10, 15 of our doctors are in Tanzania, somewhere in Tanzania, and even Kenya, I'm aware of, doing postgraduate training so that they can come and continue with our local postgraduate. But we already have local postgraduates for 5 faculties, 5 departments. So there's really progress, and there's no way we are going to solve the human resource if we only rely on South-South cooperation and partnership from our sister countries from the continent. When it comes to health information, I listened to the presentation keenly, and we have done very well. We are one within the Sub-Saharan region to digitalize the integrated disease surveillance and response. We have the digital format. It's working very well. It's not very, I would say, adequate. We are not satisfied with it, but we have done considerably very well. And we have a functional district health information system. It's working very well. We have tried to integrate into the HMIS, all those platforms like for malaria, for TB, HIV, with support from Global Fund. And we are working on the digitalization of the primary healthcare, what we refer to here as peripheral health units for chiefs and other structures we have in Ghana. And we have planned to bring in AMR in the hospitals because we have challenges in the hospitals, and that will take us to the challenges. As you know, healthcare is a big industry. One of the presenters mentioned that. So we just try to capture a few important strategic successes, but we have made considerable successes as depicted in some of the indicators. But the challenges, I listened very well to the pharmaceutical presentation and also the information, and you can see the challenges Sierra Leone has. In 2017, we did our SARA. SARA is Service Availability and Readiness Assessment. It's my directorate that conducted that. And you can see the situation with diagnosis. Basic things that can be diagnosed. Forgive me for the small, but I wanted to put a lot of information. The mean availability of tracer items, 17%. So this cuts across tertiary hospitals, we have district hospitals, and of course the primary healthcare. So it is that appalling. But that takes me to a serious issue, a challenge we have, the overseas medical treatment. And you can see that in Sierra Leone, we spent between 2013 and 2018, $2.4 million US on overseas medical treatments. And that was just for 130 Sierra Leoneans. You can imagine how that depletes the resources that were supposed to be allocated to other areas, other needs of the healthcare. So this is really a serious situation, meaning infrastructure is to the extent that those who can afford it will go abroad and spend the money. Government will also do that, as I've indicated, and therefore it undermines the possibility of building health systems, building the infrastructure. So that is a very serious one, and Ghana has been one of our countries where we send people. We need to change this, and we are working on it. You can see how much we have spent, and we spend really very huge amount of money on just very few people going abroad. Leadership and governance. Leadership and governance challenges are also here. The policies coming from the war I made reference to, although it's a couple of years, but the health infrastructure, health systems are not built overnight, and you build on the foundations you have, they were all eroded. And policies is one. And of course, sometimes the political landscape also affects. When one develops policy, the other will come and change. We are working on this, and we are also having digitalization. Digitalization started way back 2004, and it's slow because of the inadequate capacity to run the decentralized structures. So it's been slow, but the Ministry of Health and Sanitation is number one of the ministries, departments, and agencies for digitalization. We also have issues with effectiveness and efficiency in the health systems. Of course, those internally generated fund collections and things like that. Like I said before, we have weak infrastructures, and I was sitting thinking when we started, and light was going on your site, and you can imagine these are the issues we have, assuming that was a hospital, and it happens there very frequently. I know it happens in other countries of the continent, and that is why infrastructure, health infrastructure is a key challenge for us. We think it's also a key challenge for the continent. Other areas include healthcare financing. For the Abuja Declaration, we are now at 11. It was very slow to go to 11. The current government met it at 7 and has raised it to 11, but we are yet to reach the 15. Obviously, from the insecurity background, I have explained donor dependency and donor fatigue, and it's a serious challenge here. Also, low private sector involvement in health. Predominantly, our facilities are owned by government, and we are less than 30% contribution from the private sector. For me, this is important for this discussion since we are talking about African health industry. For the health management information systems, even when I have mentioned that we are making progress, I mean, that is comparatively relative to times before, but still we have challenges with the private health sector facilities having low reporting rates. We have weak monitoring. Obviously, if your HMIS, your health information management system, is weak, you have problems with monitoring. If your policies are weak, you have problem with monitoring and evaluation. We have also poor ICT infrastructure, and of course, the electricity mentioned. And then we have power tools as well we are trying to integrate. For human resource, yes, even when we have been able to recruit, we had an average before of 10,000 employees. Now we are about to get 7 to add to that. But from the labor market assessment we did, it's like we need around 24,000. You see, the WHO says for UHC, we need 45 per 10,000, and we are just there at 6. So the increments in the recruitment is not enough. But that being said, we are a civil service ministry, civil servant ministry. We are civil servants, we behave like civil servants, and we think this is not good for social health, because health to some extent has some business orientation, and we have to be very effective and efficient. We also have limited skilled medical personnel, and then also the non-medical technical people we need. I mean, we need sound accountants, we need engineers and the rest, even lawyers. I had lawyers before in my office here because I deal with policy, and one was from England at one point, the other one was from Kenya. He has even left at the moment. I don't have it, so these are all issues in terms of human resource we need to. And of course, obviously, the high attrition. I made mention of the instability previously, and we lost many of the colleagues to the diaspora. They are coming gradually, but the staff mixture of high quality staff is lacking here according to the labor markets. Yes, next slide. So we are almost ending. So you can see from all what I've said and from what we all know and from the presentations made, there are some of the challenges we mentioned are continental challenges, actually. I mean, we talk about disease prevalence gaps. The disease prevalence gaps within countries and without countries is talking about the ability for you to detect and treat diseases. And so you can see, I made mention of how we are border with Guinea, Liberia, and so diseases, because of the proximity, they move from one point to the other. That's how we got the EVD I mentioned. This is critical for the entire continent because we need to have the capacity to detect diseases as we move across, and the mobility of people, like disease mobility, I mean, technology has made it very easy. For medicines and medical technology, the presentation on pharmaceuticals was very sound. Even paracetamol in our country Before the war, we used to produce it. We don't produce it anymore. So everything from fluids are being done from by China, India, and other countries. We have Emzor here is from Nigeria. And so you can really see that everything in the health sector, including equipment, is being imported. Technology, obviously. Healthcare financing gaps, I mentioned about the Abuja and also the internally generated funds. This also, I know the continent in other countries have problems with this because for a good number of the countries, the funding for health comes from without. And these are things we have to address. And COVID has shown us that if you cannot have the medicines on the side, you cannot have the money, you cannot initiate responses. We learned a lot from that. These are continental challenges. Healthcare workforce retention. We know this is not only common to Sierra Leone, but poorer and fragile countries suffer more from this, but this is a challenge for the continent. The ICT capacity and human resources, we consider this as also continental, and we can gain so much. If I were to talk a little bit about this, you will see that even our HMIS is hosted somewhere in Ireland, and we get support from Oslo. I mean, so you can see that you can do all this kind of investment within country instead of without. And of course, infrastructure and technological challenges. At the moment, we are trying to get the manual river, the electricity, but we all know that you cannot run high-tech health facilities, particularly where you don't want to send people abroad without technology and infrastructure. On that note, we see this as opportunities for the continent. And so public-private partnership is important in as much as government alone cannot contribute to health sector. These are opportunities for African continents. We can get stronger neighbors or stronger African countries investing than doing otherwise, and investment by China, by other countries. You have also expert exchange skills and transfer programs that within the continent we can take advantage and then transfer skills from where we have more. In terms of technical skills, over the years, we really got a lot of support from Ghana and Nigeria and a few other countries. I mean, you understand that I attended University of Ghana to do my MPH. So there's a lot of capacity for this. Domestic revenue mobilization. I mean, as the continent can take strong decisions, compel governments to mobilize resources internally to add to it instead of relying on external resources. Common scheme of service and salary scales, we see this can be done in the context of WAHO if you consider West Africa, but this is important. Otherwise, you will always have the drift, like the retention I made mention of. Regional and continental ICT infrastructure, knowledge and information. So I agree more with the last presenter just before me that we need to have also a strong regional hub so that the things we need to do, we don't do it in Oslo or somewhere else, but we do it within the continent. I know South Africa has been of help to us, HIPS South Africa, but we need to bring these things closer. The last but not the least I want to talk about is the African medicine. So the pharmaceutical presentation from Ghana was very eloquent on this, and I was able to attend the ministerial meeting in Egypt in 2019, and we have to ratify the African Medicines Agency so that the continents can license. I made a point earlier that most of the drugs, in fact, for Sierra Leone, all of the medicines and medical technology come from outside. It is important that we take advantage of innovations and technologies like the drone we see from Rwanda, now we hear from Ghana. These are all things that will suit the African context. So in summary, I want to conclude to say the continent needs reform and better cooperation for health so that we can help ourselves within, and we'll definitely count on the industrial growth that is going on in some of the countries. Strong public-private partnerships is therefore required for that reform for health, so that it's not just government. And by the way, I missed some point in terms of our out-of-pocket expenditure. Sierra Leone out-of-pocket is 61%. So meaning, on top the poor quality of care, people also have to pay more money, and you have a life expectancy of 54 years. So private partnership can solve those problems within the continent, and countries like Sierra Leone can benefit. Knowledge and technology transfer is important for the continent so that we can make progress. Close disease prevalence gaps within, with focus on strengthening health systems. This is very, very important, because anytime we have an outbreak, the health systems are so weak and the outbreak will overwhelm us. So we have to have the health system strong enough to detect diseases so that we handle it before it reaches Ghana, before it reaches Liberia, and so on. So focus on health systems is important, and particularly community development and preparedness in that regard. And of course, mobilizing domestic resources so that anytime you have issues like that, you are able as a country to deal with, to start dealing with it. Of course, we have learned a lot from COVID that more resources have been mobilized and concentrated in countries that have resources, so, and they can't give it to you when they have their own problems. Lastly, but not the least, you see, we have to avoid fragility. Fragility is talking about chaos in the continent and war and all the rest. It undermines the health infrastructure, the health systems I've spoken about, and obviously the disease prevalence gaps, because you need to develop laboratories, you need to develop the ICTs, and with fragility, you don't have the money, you don't have the security. On that note, I want to thank you very much. And like I said before, please keep in loop with the ministry and the country so that we can see how the African Health Industry Summit can impact on the life of people in Sierra Leone. Thank you.